Hello everyone, I am Dr. Ghanee. Thank you for joining me and watching the videos with me. I want to show you and share with you a very interesting case today. This patient was in hygiene chair and her hygienist was working on her teeth. Her hygienist noticed this red patch on top of the tongue in the center and showed it to the patient. Patient had no idea about it, and both of them were very concerned, and they asked me to go to the room and check this lesion. All of us, when we see changes in our oral cavity, we think about bacteria, fungal elements, viruses, what is causing this. But the important part is we should look at our diet, we should look at our habits. Maybe we are making a lesion in the mouth. So I always approach it from the patient, how the patient is treating her mouth, and then I go with the other possibilities or differential diagnosis. What are the possibilities here? First of all, this is not geographic tongue, because geographic tongue is when we lose all these little projections on our tongue. It has a white border, white tan color border always, and we do not see that. Geographic tongue usually shows multiple islands here and there. The hygienist and the patient, they were worried about thrush, yeast infection. That can be a possibility, because sometimes thrush finds just one spot and we have fungal infection just in one small area in the mouth, focal infection. That can happen with yeast. Bacteria, viruses, I don't think so. I never saw these features. They always say a red lesion in the mouth can be oral cancer or precancer. So we always consider that. But at the same time, dorsal tongue, top of the tongue, very rarely shows cancer. Usually cancer is on the sides, underneath the tongue, and floor of the mouth. So I started my diet review, again, oral hygiene product review, and we talked about what is in patient's diet, what is her preference, what kind of food she goes more than moderation. And after 10 minutes, all of a sudden, patient remembered that she was going with cough drop almost all day. So this was very simple. This was just erosion because of having cough drop in the mouth for hours and hours every day. Basically, the top layer, the epithelium, is gone. I asked the patient to stop that habit, and in 2 weeks I called her and her tongue was back to normal. It's very interesting. Some people, they put cough drop in their mouth when they don't have a cold or they don't have any symptoms. A lot of joggers I see, when they're jogging, when they're preparing themselves for some kind of competition, marathons, they put cough drop in their mouth. I have seen cough drop reaction on inner cheek a lot. So many people, they keep it on their inner cheek for like 4 hours when they're running. So I thought this was interesting, and I hope you like this case. Have a good day.